Hello and welcome to the Emergency Room Podcast, the place where we delve into the fast-paced, life-saving world of emergency medicine. Are you ready to explore the critical decisions and cutting-edge treatments that happen daily in the ER?
Welcome back to the Emergency Room Podcast. We're diving deep today into something super important, especially for anyone working in emergency medicine. The PESI score.
Definitely a crucial one.
It's the tool, right, that we use to figure out how bad a pulmonary embolism is, or PE for short. And it helps us decide what to do, which in the ER, those decisions, they're often made under pressure.
Oh, absolutely. And to break it all down, we've got Dr. Monica with us. She's a real expert in emergency medicine.
Dr. Monica, thanks so much for being here. Maybe we could start with a little reminder about just how common these PEs are.
And dangerous, too.
Yeah, I mean, we're talking the third most common cardiovascular disease, right? After heart attacks and strokes.
Yeah.
And the tricky part is they can be tough to diagnose.
Absolutely. PE often goes undiagnosed, which is why having a system like the PESI score, it's so important, especially in the ER. It gives us that structure we need to quickly assess how risky things are for the patient and make sure we're doing the right thing, intervening when we need to.
Okay, so let's say you've got a patient come in and you suspect PE. What's the first thing you're thinking?
Well, before we even get to the PESI score, it's crucial to remember what a PE actually is, right? It's a blockage.
In the lung?
Yeah, in one of the arteries in the lungs. Most often it's caused by a blood clot that's traveled from the legs. That's what we call deep vein thrombosis, or DVT. And the thing is, the symptoms of a PE, they can be really varied. You might have almost no symptoms, or you could have sudden cardiac arrest.
So you have to assess things fast.
Rapid assessment is key, absolutely.
And that's where PESI comes in, right?
Yeah.
It gives you a structured way to look at different factors and decide, okay, how high risk is this patient?
Break it down.
Yeah, break it down. So, Dr. Monica, what are those factors? What are we looking at with this score?
5 key factors. We start with age. If the patient is over 80, they get a point.
Right off the bat, age is a risk factor. What's next?
Next, we look at any underlying health conditions. So things like cancer, heart failure, chronic lung disease, each one of those adds a point. Because those conditions, they can make someone more vulnerable to complications from a PE.
So we're building a picture of the patient's health. And then we look at
Vitals, heart rate, blood pressure. A heart rate over 110 beats per minute, or a systolic blood pressure under 100 millimeters of mercury, those each add another point.
Makes sense. You got to look at how the body's responding to a potential blockage, right?
Exactly.
Okay. What else?
Then we check oxygen levels. If their oxygen saturation is below 90% on room air, that's another point. And it's a sign that they're having trouble getting enough oxygen into their blood.
Difficulty breathing. That's a big warning sign.
Yeah.
And the final factor.
Mental state. Are they alert-oriented? Or are they confused? Maybe their mental state is altered. If so, we add a point. That can indicate a more serious situation.
So we've got these 5 factors. Age, underlying conditions, vitals, oxygen levels, mental state. We add up the points, and then what? What do we do with that score?
Well, that's where the PESI classes come in. They help us put patients into different risk groups based on their total score. So let's start with class 1. That's the best case scenario, 0 points.
So that means low risk, right?
Exactly. Class I means a very low chance of complications or death from the PE. Now, if they have 1 point, that's class 2.
Still pretty low risk.
Yeah, relatively low risk. But the chance of complications is a bit higher than class 1, so we start to be a little more concerned.
Each point matters. Okay, what about 2 points?
2 points is class 3, and that's where we move into moderate risk territory. The chances of complications are getting significant.
Things are getting more serious. And 3 to 5 points.
That's class 4. Highest risk category. Those patients have a high likelihood of complications and potentially even death. It's a situation that needs attention right away. Aggressive treatment.
Wow, so the PESI score tells you how urgently you need to act. But how does that translate to treatment? Does it dictate what you do for the patient?
Oh, absolutely. The PESI score is super valuable for guiding treatment. We tailor what we do based on the risk level. So, for example, if they're low risk, class I, we might think about outpatient treatment, maybe anticoagulant.
To prevent clotting.
Right. But for a high-risk patient, someone in class 4, we might need to get more aggressive. We might even need to think about thrombolysis.
That's where you use medication to break up the clot, right?
That's right. Or in some cases, if it's really serious, we might have to do an embolectomy.
Which is surgically removing the clot.
Exactly. So you can see the PESI score helps us figure out the level of urgency and what treatment strategy makes the most sense. Whether it's medication, minimally invasive procedures, or surgery, it's all about giving the best care possible to each patient based on their own level of risk.
This has been so helpful, Dr. Monica. So to recap, we talked about what a PE is, why you have to assess things so quickly, and then we went through those 5 parts of the PESI score: age, underlying conditions, vital signs, oxygen levels, mental state, and how the score gets categorized into different risk classes.
Right.
And how those classes really impact how we treat the patient, from outpatient anticoagulation for low-risk patients all the way to those potentially life-saving interventions like thrombolysis or embolectomy for high-risk patients.
It's a powerful tool.
It seems pretty straightforward, but there's actually a lot of nuance to this scoring system.
Absolutely. And it's not static. The research is ongoing.
You're right. There's research looking at other factors that could make risk assessment even more precise, things like blood biomarkers and advanced imaging.
Exactly. We're always trying to refine our understanding and personalize treatment, make sure each patient gets the most effective care.
That's what I love about emergency medicine, and it's always moving forward.
Yeah.
So for our listeners out there, especially if you're in the ER, you got to keep up with these advancements.
For sure. The more we understand about PE and the tools we have, the better we'll be at saving lives.
Couldn't have said it better myself. Huge thank you to Dr. Monica for joining us today and explaining the PESI score. This has been a great deep dive.
It was my pleasure. Thanks for having me.
And for everyone listening, don't forget to subscribe to the channel for more deep dives into these important medical topics. We'll catch you next time.
You know, one thing I always think about with the PESI score is how important it is to really listen to the patient, take a good history.
Yeah, that's key in medicine, right?
Yeah.
You can't just rely on the numbers. You have to understand the person in front of you.
Exactly. The PESI score, it's a fantastic tool, but it doesn't replace good clinical judgment. Like, let's say you have a patient and their score is pretty low, but something about their story or what you're seeing when you examine them, it just doesn't feel right.
So maybe their symptoms are unusual or their story doesn't match up with what you're seeing.
Exactly. In those cases, you have to trust your gut. Maybe order more tests or even consider a higher level of care, even if the PESI score alone wouldn't make you do that.
So it's about the whole picture, not just the numbers.
Absolutely. And that's where experience comes in. The more PEs you see, the better you get at recognizing those little signs that something might be off.
I bet that's especially true with mental status. It can be subjective, right?
Yeah, definitely. You're looking for signs of confusion, disorientation, maybe even agitation. But sometimes those signs are really subtle, or they could be from something else, like pain or medication.
How do you figure that out then? Make sure you're getting that part of the PESI score right.
It comes down to good communication and observation. Asking the right questions, really engaging with the patient, and watching how they're behaving.
I'm sure having a good rapport with the patient helps a lot.
It makes a huge difference. When patients feel comfortable with you, they trust you, they're more likely to open up, share important information. And sometimes it's that one little detail they mention that can change everything.
It sounds like the PESI score is super helpful, but it's just one piece of the puzzle when you're diagnosing and managing a PE.
That's a great way to put it. It helps you stratify risk, guide those initial treatment decisions, but in the end, it's your judgment as a clinician, your experience, and that patient's individual story that helps you figure out the best way to go.
And that's what makes emergency medicine so challenging and so rewarding. You're always thinking on your feet, putting all the pieces together, making decisions that really impact people's lives.
Exactly. And that's why we have to stay up to date on the latest research, the best practices, like the PESI score, to make sure we're giving the best care we can.
I'm curious, Dr. Monica, from your experience, are there any specific situations where the PESI score is especially helpful? Certain presentations or certain types of patients?
That's a good question. I'd say one area where it's really valuable is when you have a patient come into the ER with chest pain.
Which is a really common complaint, right?
Oh, it's one of the most common. It can be caused by so many things. Could be something totally benign like heartburn, or it could be life-threatening like a heart attack, or of course, a PE.
So the PESI score can help you narrow things down. Focus on the patients who are most likely to have a PE.
Exactly. By quickly assessing their risk factors using the PESI score, we can pick out those patients who need a more urgent evaluation, maybe more aggressive treatment. It can be super helpful in a busy ER when resources are stretched thin.
Makes sense. It helps you prioritize. Make sure the sickest patients get seen right away.
Right. And it can also help us avoid unnecessary testing and interventions in patients who seem to be low risk based on their PESI score.
So it's useful for identifying high-risk patients, but also for reassuring low-risk patients.
Exactly. It helps us make informed decisions and really tailor our approach to each patient.
That's really interesting. It shows how a tool like this can make things more efficient, improve quality of care in the ER.
It really speaks to the power of evidence-based medicine and how important it is to always be refining what we do to provide the best care for our patients.
You mentioned earlier that the research on PE and risk assessment is ongoing. What are some of the exciting things on the horizon that our listeners should know about?
Well, there's a lot of cool research going on. One really promising area is the use of biomarkers, which are basically substances in the blood that can tell us if there's a clot.
So instead of just going by symptoms, you might actually be able to measure the clot directly.
Exactly. And some of these biomarkers are showing real potential. They can help us identify patients who are at high risk of developing a PE even before they have any symptoms.
That's amazing. Early detection could be huge for PE treatment.
It really could. And another exciting area is advanced imaging techniques. We're getting better at visualizing the lungs, detecting clots that we might have missed with traditional imaging.
Some more accurate ways to see what's going on in the lungs.
Precisely.
Yeah.
And that could mean earlier diagnosis, more targeted treatment.
This is all really exciting stuff, Dr. Monica. Sounds like the future of PE diagnosis and management is looking pretty good.
It really is. We're making great progress, and I'm sure we'll keep developing new and innovative ways to improve outcomes for patients with PE.
It's great to hear about all this progress. But before we get ahead of ourselves, let's come back to the PESI score, its role in current practice.
Sounds good.
One thing I've been wondering about is, are there any limitations to the PESI score? Are there situations where it might not be as reliable or accurate?
That's a really important point. The PESI score is great, but it's not perfect. Remember, it's based on statistics, and there will always be patients who don't fit neatly into those categories.
So there's always a chance someone could be misclassified as higher risk or lower risk than they really are.
Yeah, that's possible. You could have a younger patient, no underlying conditions, who scores low on the PESI, but they could still have a big clot that's causing problems.
So you have to consider the whole patient, not just rely on the score.
Absolutely. The PESI score, it's a guide, not a rule.
Yeah,
Use your judgment. Look at all the information you have when you're making decisions about treatment.
that makes sense. Any other limitations our listeners should know about?
Well, one thing to remember is that the PESI score, it was developed using data from patients who came to the hospital. So it might not be as accurate at predicting outcomes for patients who are diagnosed with a PE in other places, like a clinic or during a hospital stay for a different reason.
So how well it predicts things might be different depending on where the PE is diagnosed.
Exactly. And another thing, the PESI score doesn't take into account every possible risk factor for PE.
Like what?
Things like recent surgery, being immobile for a long time, pregnancy, or even certain genes that make someone more likely to clot. Those factors could increase someone's risk, even if their PESI score is low.
So you need to take a good history. Think about all the possible risk factors,
Yeah.
not just the ones in the PESI score.
Exactly. And it's always better to be safe than sorry. If you have any doubts about a patient's risk, it's better to do more testing or talk to a specialist.
This has been so insightful, Dr. Monica. You've really helped us understand all the ins and outs of the PESI score, the strengths and the limitations.
It's been my pleasure. It's so important for clinicians to understand the tools we use and to use them the right way.
Couldn't agree more. Speaking of using tools the right way, I'd love to talk a bit more about how the PESI score is actually used in practice.
Sure. What would you like to know?
Well, we talked about how the PESI score helps you put patients into different risk groups. Could you walk us through the specific treatment recommendations for each class? Like, what does management look like for a Class I patient versus a Class 4V patient?
Of course. Let's start with Class I. That's our lowest risk group. These patients, they have a very low risk of complications. We can often manage them safely as outpatients.
So they don't need to be admitted to the hospital, usually.
Right. We'll usually start them on anticoagulants to prevent more clotting. And we make sure they follow up closely so we can keep an eye on how they're doing.
What kind of anticoagulants are we talking about?
There are a few different options. You've got the direct oral anticoagulants, like apixaban, rivaroxaban, and then there are the traditional medications, like warfarin. Which one we choose depends on a few things, like the patient's medical history, their preferences, and cost.
So it's about finding what works best for each patient.
Exactly. Now, when we move up to the higher risk categories, the treatment gets more intense. For Class 2 patients, where the risk of complications is a little higher, we might keep them in the hospital for a bit, just to observe them before sending them home on anticoagulants.
Just to be sure things are stable.
Exactly. Now, with Class 3 and 4, things get more serious. Those patients, they're at a much higher risk of complications, including death.
So at that point, they definitely need to be hospitalized.
Absolutely. They need to be admitted so we can monitor them closely and give them more aggressive treatment.
What does that more aggressive treatment look like?
Well, in addition to anticoagulation, we might think about thrombolysis, which, like we talked about before, involves using medications to actually break up the clot. We usually save that for patients who are hemodynamically unstable, meaning their blood pressure is dropping or they're showing signs that their organs are being affected.
So in those critical cases, it can save their life.
It really can. And sometimes if thrombolysis isn't an option or if it doesn't work, we might even have to surgically remove the clot. That's called an embolectomy.
That sounds pretty serious.
It is. It's a last resort. But in some situations, it can be life-saving.
This is all so fascinating, Dr. Monica. I'm really getting a sense of how complex PE management can be and how the PESI score helps guide those really important decisions.
It's a dynamic field, for sure, always evolving. And the PESI score has been a valuable tool helping us standardize care, improve outcomes for patients with PE.
I have one more question for you before we move on. You mentioned the limitations of the PESI score, but are there any other controversies or areas where people disagree about how it's used?
That's a great question. The PESI score is widely used and accepted, but there are a few things that people are still discussing and debating. One thing is the cutoff point for hospitalization.
You mean deciding who needs to be admitted versus who can be treated as an outpatient?
Exactly. Some clinicians, they like to be more conservative. They'll admit any patient with a PESI score above 0, but others are comfortable managing some Class 2 patients as outpatients, especially if they have good support at home and can follow up closely.
So there's some room for individual judgment and making decisions based on the specific patient.
Absolutely. And another area of debate is the role of advanced imaging in low-risk patients.
You mean whether to do a CT scan or other imaging in patients who have a low PESI score?
Exactly. Some people argue that imaging isn't necessary in those patients because their risk of PE is so low. But others think imaging is still important to definitively rule out a PE and avoid problems down the line.
So a balance between not doing unnecessary tests and making sure you're not missing any cases.
Exactly. And the decision of whether or not to do imaging in low-risk patients, it often comes down to a conversation between the doctor and the patient, taking into account their individual risks, their preferences, their concerns.
It's a reminder that medicine isn't always black and white. There are often gray areas where you need to use your judgment and make decisions together with the patient.
I totally agree. And that's what makes it so challenging and rewarding. You're always learning, adapting, trying to give the best possible care to your patients.
Well said, Dr. Monica. This has been a really insightful discussion about the PESI score and how it's used to manage PE. Thanks for sharing your expertise and insights with us.
My pleasure. I hope it's been helpful and informative for everyone listening.
I'm sure it has. And for everyone out there, stay tuned for the final part of our deep dive. We'll be talking about some fascinating new research and what the future holds for diagnosing and treating PE. Welcome back to the Emergency Room Podcast. We're finishing up our deep dive into the PESI score with Dr. Monica, and we've covered a lot of ground, haven't we? Talking about how we use it to figure out what to do for patients with pulmonary embolism.
It really has been quite a journey, exploring all the little details of the scoring system.
It really has. And I think one of the key takeaways for me is how the PESI score, while it's a great tool, it's not the whole story.
Absolutely. You have to use good clinical judgment, take a thorough history, really listen to what the patient is telling you. All those things are crucial.
And the exciting thing is that research is always moving forward, right? We're always learning more about PE, getting new tools to improve how we care for patients.
You know, when I think about the future of PE management, what really gets me excited is the potential of personalized medicine.
Oh, tell me more about that. What does personalized medicine mean when we're talking about PE?
Imagine being able to use genetic testing to figure out who's predisposed to clotting.
Wow, so you could do something even before a PE happens.
Exactly. We could focus on prevention for those patients, lifestyle changes, maybe even prophylactic anticoagulation, tailor it to those who are at the highest risk.
That's incredible. You could prevent PE altogether.
We could. And another area with huge potential is new anticoagulants.
I know we touched on those before. What's different about these new ones?
Well, they're even more targeted, more effective, and fewer side effects. That's what researchers are working on.
That would be amazing.
Yeah.
Especially for patients who need to be on anticoagulants long term.
Absolutely. And some of these new drugs are even being developed to actually dissolve clots better. So maybe in the future we won't need thrombolysis or embolectomy as much.
That would be huge.
Hmm.
Less invasive treatments mean faster recovery for patients, fewer complications.
Exactly. And as imaging technology gets better, we'll be able to see those clots even more clearly, pinpoint them, and do more targeted treatments.
So we're talking about a future where we can not only identify who's at risk, but also personalize their treatment based on their genes and what their clot looks like.
That's exactly right. It's a future where we move away from the one-size-fits-all approach to PE and truly personalized treatment for each patient.
That's really inspiring, Dr. Monica. It sounds like the future of PE care is pretty bright.
It is. We're making incredible progress. I'm confident we'll see even more amazing breakthroughs in the years to come.
Well, Dr. Monica, this has been an incredible deep dive into the PESI score and beyond. Thank you so much for sharing your expertise.
It's been my pleasure. I hope everyone listening found this discussion interesting, maybe even got you thinking a bit.
I'm sure they did. And to all of you listening, keep that curiosity going. Keep learning. Keep an eye out for those exciting advancements that are changing medicine.
And don't forget the basics. A good history and physical exam are still so important.
The foundations of good medicine. Well said, Dr. Monica.
And that's a wrap for this episode of the Emergency Room Podcast. Thanks for joining us, and we'll see you next time for another deep dive into the world of emergency medicine.
Until then, stay safe, everyone, and keep those brains working.
Thanks so much for joining us today on the Emergency Room Podcast. Please smash that like button. It helps us reach more colleagues and keep the educational content coming. Don't forget to share this video with your fellow healthcare professionals. And if you're not already part of our community, please subscribe to the channel and hit the bell notification so you never miss out on our next cutting-edge discussion. We're dedicated to providing the most up-to-date, evidence-based information to keep you at the forefront of emergency medicine and critical care.